Welcome back to my channel Radiant Living. I am Dr. Pramod Joshi, MD Medicine, practicing since last 43 years. Today in this video, I'll make you aware of an important medical condition, that is stroke. You all know about heart attack. Similarly, a brain attack is called as stroke. If we treat stroke in time, we can reduce the disability. Do watch this video till end to learn to quickly identify symptoms of stroke and act fast. In stroke, person can have loss of power on one side of the body. He can have slurred speech or loss of speech. He can lose power to swallow. He can lose control over urination and defecation. He can also have loss of some higher brain functions. Sometimes he can have altered sensation in one part of the body. The stroke is a major health burden in India as it affects millions. Almost 150 people per lakh are affected in India. Stroke can be of two types, ischemic stroke and hemorrhagic stroke. Ischemic stroke happens when the blood flowing in the artery towards brain gets blocked. And a hemorrhagic stroke happens when the weakened wall of the artery ruptures and causes bleeding inside the brain. In both these situations, there is lack of blood flow and oxygen deprivation which can damage brain cells. Nearly 30% of the adult population in India is having hypertension, and uncontrolled hypertension is responsible for almost 35 to 40% of the strokes. The tobacco chewing and smoking can cause narrowing in the arteries which can get easily blocked and worsen chances of stroke. Diabetes is rapidly increasing in India, and uncontrolled diabetes can cause increased atherosclerosis and narrowing of the arteries and increase the risk of the stroke. Traditional Indian diets are very high in fat and cholesterol, so they can increase atherosclerosis process and cause increased chances of blocking the arteries. In heart, sometimes the clot can happen due to irregular beating of the heart or on a damaged heart muscle due to heart attack. These clots can get dislodged and block the arteries in the brain and can cause stroke. It is very important to quickly recognize stroke symptoms F.A.S.T and act fast. F is for the face drooping, A is for the arm or limb weakness, S is for speech difficulty, and T is the time to call ambulance quickly. A stroke patient has to reach ICU as early as possible so that he can get the benefit of clot dissolving medicine to re-establish the blood supply to the brain. If person reaches beyond 4.5 hours, the clot busting medicines are not effective. So don't waste time going to some nearby place or some small hospital, and don't waste time doing something else, but reach the treating ICU where CT scan facilities are available. The golden hour, why it matters? Because time is brain. Every minute counts. After stroke onset, the brain damage goes on worsening. The 4.5 hour window period though it is given, the person has to reach as early as possible. The person gets treatment at first hour, 1.5 hour, the damage is minimum and we can restrict the disability. The urgent care given by the stroke unit definitely stabilizes the person, prevents the death and saves the brain function. As soon as person reaches hospital, in the stroke treatment unit, the first thing we do is a quick brain imaging, that is CT scan or MRI, to diagnose whether it is ischemic stroke or hemorrhagic stroke. Once the ischemic stroke is diagnosed, we start plan for giving clot bursting drugs or thrombolysis, which can re-establish the blood supply through the artery by dissolving clot and limit the damage. Sometimes we have to go for mechanically removing the thrombus by putting wire inside the artery and removing mechanically the clot. This can be possible only in the large arteries and the clots which are accessible from inside. But the window period for mechanical thrombectomy is about 12 hours. In addition to these methods of treatment, we require a lot of supportive care. If the person's respiration gets affected, he may need mechanical ventilation. If his BP has wide fluctuations, which has to be treated according to the guidelines and the important drugs which are advised in the guidelines. The unconscious person, we need to put in the tube for feeding and also put the tubes and catheters for proper urine drainage. Take all nursing cares of an unconscious patient, prevent bed sores by giving the air beds, etc. If the imaging of the brain shows hemorrhagic stroke, the management initially to control the blood pressure according to guidelines. If the person is of anticoagulation, we have to plan reversal of coagulation. There is a high chance that these patients develop fits. So we have to give prophylactic medicines for prevention of fits. Because of bleeding, there is a rapid increase in pressure inside the skull, which has to be managed with medicine or sometimes with surgical interventions like craniotomy, where a bone flap is removed for the brain expansion. After imaging, usually angiography is planned to check where the artery is bleeding and whether there is some ballooning or aneurysm of the artery. If you find aneurysm which is leaking, it can be clipped or coiling can be done. Sometimes we get arteriovenous malformations bleeding. There we have to embolize the feeders of this malformation. Once you have done all the acute treatment for removing the clot or bursting the clot and taking care of blood pressure, diabetes, respiration, and taking all care of the brain compression or unconscious patient over first 15 days. Then we plan stroke rehabilitation and regaining independence. Physiotherapy is most important for first 6 weeks and even later on to improve the person's muscle power and his balance. The person has to improve his communication by good speech therapy and improve the swallowing skills so his tube can be removed. If the person has lost some function in one hand and was doing some job, we can give him a occupational therapy, teach him some new skills with the healthy hand and re-establish them in his work so that he can take care of himself and some job he can do. That boosts his moral. Psychological support is very important from the family and the friends group. It addresses the emotional health and for a better recovery. Though the stroke has taken some power and some speech, the spirit of the person should not be gone to improve. Preventing stroke through lifestyle changes. Person has to stop tobacco chewing, stop smoking, do regular daily 30 minutes exercise to remain fit. One should take low fat, low cholesterol diet so that the atherosclerotic process doesn't progress fast. One should control hypertension well and keep it controlled with regular follow-up. The diabetes has to be controlled well and the HbA1c must be maintained less than 7. After lifestyle interventions for stroke prevention, we will see what are the medical interventions. The drugs, medicines that prevent stroke are aspirin or clopidogrel or their combination. They are prescribed for the stroke patient lifelong to prevent future strokes. Some people who have got irregular heart beating or atrial fibrillation will require anticoagulation with certain medicines so that the risk of stroke can be reduced. Sometimes the large artery supplying brain, that is carotid artery, has got critical narrowing. We can do end arterectomy, that is remove the block inside the artery. The narrowed part is stented with a stent so that the blood supply to the brain remains good and no clotting happens. I hope you have learned everything about stroke and improved your stroke awareness. Now you are ready to recognize fast F.A.S.T symptoms of stroke and act fast. Because usually a stroke patient cannot himself go to the hospital. He has to be carried by other family members, society people, or working colleagues or friends. So do spread this message to your families, societies, working place and all friends circle. Do like it and share it to maximum people so they are ready to take a call for a fast action if they see a stroke patient. By doing this, we can take the patient very early to the hospital, get the best treatment and reduce the burden of stroke and reduce the disability. Thank you.